Patrick, the first two community calls of March focused on standardized vocabularies, especially following the release in late February. For those who aren't, don't fully understand the role of standardized vocabularies in Odyssey research, can you just talk a little bit about their importance?
Absolutely. Well, first, I want to just give a big shout out and thanks to the vocabulary team. Anna and Alexander and Oleg presented at the first week of the month, highlighting the work of the entire vocabulary team to have our February 2024 release, following the roadmap that we've established and that we've been trying to follow to. And this vocabulary release comes with a lot of important improvements, particularly in the condition domain, where there's been a lot of great improvements focusing on the mappings associated with ICD and MEDRA, and incorporating new vocabularies and SNOMED, as well as the other vocabularies. I think more broadly, the Odyssey standardized vocabulary, it serves as the foundation for our common data model, because it provides us this basic ability to have a common language that we can speak across all of the different databases across our network. And increasingly, as we see so many countries adopting the OMOP common data model and so many databases across North America and Europe and the Asia Pacific regions, increasing interest in Africa and Latin America, each of these countries have different source vocabularies, different languages, and yet if we want to do global research at scale, we need to have one common language that we can speak, and the Odyssey standardized vocabulary provides that for our entire community, as well as the thousands of organizations who are downloading the vocabulary on a regular basis that are taking advantage of this as a core public informatics resource that our community maintains.
Vocabulary serve as a discriminator for the OMOP CDM, and there's a lot of CDM talk this month and certainly next month. We'll get to that in a second. But one of our Odyssey collaborators, Jamie Weaver, took part in a discussion earlier in March about different CDMs. I know you watched that. What stood out to you about that conversation?
Yeah, I appreciated Jamie Weaver representing our community on an important conversation that was taking place as part of a seminar series with Health Canada, as researchers in Canada are seeking to determine how they can more actively engage in international collaborative research. And so in this workshop, Judy Morrow represented the U.S. perspective from the FDA Sentinel Initiative. Robert Platt was there representing the work that's been going on in Canada, and Jamie Weaver showcased the work that we're doing here in the Odyssey community. And a lot of the conversations were really about which common data model of the many that are out there can and should folks be considering using, and the principles that go into that. And I thought that Jamie did a wonderful job of representing our community and highlighting that it really isn't just about a data model. While there exists multitude of organizations that have created a document that specifies how data can be structured, the work we're doing in the Odyssey community goes much further than that, and to a certain extent makes that debate obsolete. Because really, when we think about the work we're doing in the Odyssey community, it's more than just a way to standardize data structure in terms of the data and fields. It goes on to thinking about how we standardize the content with our standardized vocabulary, how we standardize the conventions for how to ETL data into the common data model, how we standardize analytics so that we have the common capacity to conduct characterization, estimation, and prediction studies, how we standardize the approach to conducting network research and generating evidence. And you really need all of that in an overarching open community framework to make data actually reach its true potential in terms of the value it can bring to patients. And so while the OMOP common data model is something that our community uses as a backbone, I think Jamie did a really nice job of highlighting that that is only a very simple start of an overall process, and we need the entire Odyssey community focused on the bigger picture objective to achieve goals. And that's something that I think does uniquely differentiate our Odyssey community from other efforts who just have a common data model.
Talk about common data model, and we have coming up, led by Claire Blacketer and Melanie Flofsky, the leads of our CDM and Themis work groups, a community-wide collabathon called April Olympians that really is going to focus on conventions within Themis and CDM. What are you hoping can come out of this event?
Yeah, I think in a nice transition from talking about the vocabulary in Jamie's presentation, there still is a lot of work for our community to be doing together. Melanie's been doing a remarkable job with our health system special interest group, making sure that those who have source data coming from different electronic health record systems start thinking about common shared practices that they can have, and has been working as part of the Themis effort to try to see if we can ratify common conventions that everybody can follow. And Claire's been doing a wonderful job leading our common data model work group, where we're trying to make sure that everyone understands not only what is that data standard, but also how the conventions fit into decisions about how to transform source data into that. But what we've recognized is, as our community has grown, as the various communication channels that we've had have continued to expand, we see a lot of very fruitful and important conversations going on in many different forums, whether it be on our work group meetings, within our MS Teams environment, on the OHDSI forums, in the Legacy Wiki environment, and really there's an opportunity for us as a community to come together to make sure that we have one common repository that contains all the conventions that we've agreed to as a community, and to find the gaps in our conventions so that as we continue to evolve, improving our data quality procedures and improving the fitness for use of our data to generate evidence, that we have a common resource that we can all take advantage of. So I appreciate Claire and Melanie engaging in our April Olympiad activity, and I really look forward to seeing everybody in the community take part and contribute to this community effort.
Yeah, while the effort will go on throughout the month, each community call will have updates of what is happening, but also some presentations or tutorials just around the entire ETL process, from vocabularies to tools. So plenty of information in this newsletter and on the community calls page. Really looking forward to this month and seeing how this goes. And we have symposiums coming up. We have Europe in early June. We have the Global Symposium in October. We have great work being done by our scientific review committee already, helping to plan that. And we're looking forward to great events coming up in April and beyond. Thanks for joining, Patrick.
Thanks, Craig. Science!